Medical Assistant Exam Laboratory Procedures Review. Question 1. A medical assistant is working in a phlebotomy station when the term dermatology appears in a referral. Which specialty is involved? Option A, blood. Option B, kidney. Option C, skin. Option D, heart. The correct answer is option C, skin. Dermatology is the specialty focused on skin conditions. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Cardiology focuses on the heart. Question 2. The care team in a patient education session asks for guidance because an electronic record uses an audit trail. What is its purpose? Option A, measure blood pressure. Option B, track who accessed or changed information. Option C, approve insurance claims instantly. Option D, sterilize instruments automatically. The correct answer is option B, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Question 3. As part of exam preparation in a women's health clinic, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, appendix. Option B, thyroid gland. Option C, urinary bladder. Option D, gallbladder. The correct answer is option B, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 4. In a medical office workflow, a prothrombin time test is ordered. Which tube should be selected? Option A, gray tube. Option B, light blue tube. Option C, blood culture bottle only. Option D, lavender tube. The correct answer is option B, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Gray fluoride oxalate is not the standard additive for coagulation studies. Blood cultures detect microorganisms and are not used for prothrombin time testing. Lavender EDTA is used for hematology and can interfere with coagulation testing. Question 5. Before the visit continues in an internal medicine office, a medication is labeled for otic use. Where should it be administered? Option A, ear. Option B, eye. Option C, mouth. Option D, nose. The correct answer is option A, ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Nasal medications are administered through the nose. Question 6. The care team in a clinical skills review asks for guidance because the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, otoscope. Option B, ophthalmoscope. Option C, centrifuge. Option D, reflex hammer. The correct answer is option B, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. An otoscope is used for the ear canal and tympanic membrane. A centrifuge separates specimen components and is not an eye exam tool. A reflex hammer tests reflexes and does not visualize the retina. Question 7. Following office protocol in a quality control review, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A, light blue sodium citrate tube. Option B, gray fluoride oxalate tube. Option C, lavender EDTA tube. Option D, green heparin tube. The correct answer is option A, light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Gray tubes are generally collected near the end of the order. EDTA tubes are collected later because the additive can contaminate other tubes. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Question 8. As part of exam preparation in an administrative check-in area, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, correct the date of birth without asking anyone. Option B, stop and resolve the discrepancy before proceeding with care. Option C, use the appointment time as the identifier. Option D, continue if the last name matches. The correct answer is option B. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Question 9. A medical assistant is working in a family practice clinic when a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask a family member to confirm the name only. Option B. Label the tube after returning to the lab. Option C. Use the room number because it is faster. Option D. Ask the patient to state 2 identifiers and compare them with the order. The correct answer is option D. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A room number can change and is not considered a reliable patient identifier. Question 10. To protect safety in a clinical skills review, the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A. Tendons. Option B. Alveoli. Option C. Villi. Option D. Ureters. The correct answer is option B. Alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Tendons connect muscle to bone. Villi increase absorption in the small intestine. Ureters carry urine from the kidneys to the bladder. Question 11. At the start of care in a same-day appointment, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Provide instructions in the wrong language. Option B. Use clear language and review the key points with the patient. Option C. Tell the patient to search online without guidance. Option D. Use only complex medical terminology. The correct answer is option B. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Question 12. A medical assistant is working in a women's health clinic when a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option B. Ignore all provider instructions about inhalers. Option C. Wear tight clothing that restricts breathing. Option D. Eat a heavy meal immediately before every test. The correct answer is option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. Restrictive clothing can interfere with respiratory effort. A heavy meal may interfere with comfortable breathing for some tests. Question 13. During a medical office workflow, a patient asks which body system includes the skin. Which system should be identified? Option A. Respiratory system. Option B. Integumentary system. Option C. Endocrine system. Option D. Urinary system. The correct answer is option B. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The endocrine system is made of hormone-producing glands. The urinary system filters blood and eliminates urine. Question 14. Given the workflow in a same-day appointment, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Ignore the error even if it affects care. Option B. Ask a coworker to change it under their login. Option C. Delete the original note completely. Option D. Make an addendum according to office policy. The correct answer is option D. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Clinically important errors should be corrected through proper procedures. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Question 15. During a community health clinic, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, left arm below the clavicle. Option B, fourth intercostal space at the right sternal border. Option C, fifth intercostal space at the left midclavicular line. Option D, a fourth intercostal space at the left sternal border. The correct answer is option B, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. That location corresponds to V2. Question 16. Given the workflow in a pediatric clinic, a reagent bottle is past its expiration date. Which action is appropriate? Option A, use it only for abnormal patients. Option B, do not use it for patient testing. Option C, change the expiration date on the label. Option D, mix it with a new reagent to strengthen it. The correct answer is option B, do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Expired reagents are not reliable for any patient testing. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Question 17. In a preventive care visit, a peak flow test is ordered. Which body system is being assessed? Option A, urinary system. Option B, skeletal system only. Option C, integumentary system. Option D, respiratory system. The correct answer is option D, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. Question 18. At the start of care in a patient intake station, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, tell the patient to bring personal gloves only. Option B, ignore the allergy if the procedure is short. Option C, use powdered latex gloves because they are easier to put on. Option D, use latex-free supplies and clearly communicate the allergy. The correct answer is option D, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. Question 19. An office review in an infection control audit shows that a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, use the parent's estimate if the scale is nearby. Option B, round weight to the nearest 10 pounds. Option C, record the measurements using the unit required by the office protocol. Option D, record height only because weight changes often. The correct answer is option C, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Question 20. As part of exam preparation in an exam room, a used needle must be discarded after an injection. Which practice is safest? Option A, carry the needle to the front desk for disposal. Option B, recap the needle with both hands. Option C, place the needle in regular trash. Option D, activate the safety device and place the needle in a sharps container. The correct answer is option D, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 21. A medical assistant is working in a women's health clinic when the suffix itis appears in a medical term. Which meaning is most accurate? Option A, pain. Option B, removal. Option C, inflammation. Option D, study of. The correct answer is option C, inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 22. As part of exam preparation in a quality control review, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A, the center of the thumb pad. Option B, the little finger near the bone. Option C, the side of the middle or ring finger pad. Option D, the tip of the index finger. The correct answer is option C, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The thumb is often calloused and has a pulse, making it less preferred. The little finger has less tissue over bone and is usually avoided. The index finger is commonly used for touch and may be more sensitive or calloused. Question 23. After reviewing the situation in a walk-in clinic, a patient falls in the exam room. Which action is best? Option A, tell the patient to drive home without evaluation. Option B, pull the patient up immediately. Option C, call for help and assess for injury before moving the patient. Option D, hide the incident if no one saw it. The correct answer is option C, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Moving the patient before assessment can worsen an injury. Falls must be reported and documented according to policy. Question 24. To protect safety in a walk-in clinic, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, handle the dressing with bare hands. Option B, use gloves and dispose of the dressing according to biohazard policy. Option C, save the dressing in the patient's purse. Option D, place the dressing on the clean supply tray. The correct answer is option B, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Soiled material can contaminate clean supplies. Question 25. As part of exam preparation in a treatment room, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, the assistant's diagnosis before the visit. Option B, demographics, contact information, insurance information, and reason for visit. Option C, another patient's insurance card. Option D, only the patient's favorite pharmacy color. The correct answer is option B, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. Insurance information must belong to the patient being registered. That information does not complete registration. Question 26. After reviewing the situation in a clinical skills review, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, follow the office release of information process. Option B, give the record to anyone who asks. Option C, refuse because records belong only to the provider. Option D, delete sensitive information before the request is reviewed. The correct answer is option A, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Question 27. Following office protocol in a preventive care visit, the provider is running behind and a patient asks for an update. Which response is professional? Option A, guarantee an exact time even when it is unknown. Option B, apologize for the delay and provide the best available estimate. Option C, discuss another patient's emergency as the reason. Option D, tell the patient that waiting is their only option. The correct answer is option B, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. False certainty can create more frustration. Sharing another patient's situation can violate privacy. Dismissive communication is unprofessional. Question 28. While working in a medical office workflow, a waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, record patient results without documenting controls. Option B, change the patient's diagnosis to match the meter. Option C, use the meter because patient samples are different. Option D, resolve the quality control problem according to protocol. The correct answer is option D, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 29. In a clinical skills review, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, leave the patient alone until they stop coughing. Option B, perform blind finger sweeps immediately. Option C, encourage coughing and monitor closely. Option D, give the patient food to push it down. The correct answer is option C, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Blind finger sweeps can push the object deeper and are not appropriate. Food can worsen the obstruction. Question 30. In an internal medicine office, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A, the blood pressure may read falsely high. Option B, the pulse oximetry reading will be inaccurate. Option C, the temperature will be elevated. Option D, the blood pressure may read falsely low. The correct answer is option A, the blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. Cuff size has no direct effect on body temperature. A cuff that is too large is more likely to produce a falsely low reading. Question 31. An office review in a phlebotomy station shows that the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A, face the patient and speak clearly at a moderate pace. Option B, assume the patient cannot participate. Option C, cover the mouth while speaking. Option D, shout from another room. The correct answer is option A, face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Hearing difficulty does not mean the patient cannot understand or decide. Covering the mouth removes visual cues. Shouting from a distance reduces clarity and privacy. Question 32. Given the workflow in a telephone triage workflow, a specimen label is missing after collection. Which action is best? Option A, send the tube with no label and explain later. Option B, ask another patient if the tube belongs to them. Option C, follow facility policy for recollection or correction without guessing. Option D, write a name on the tube from memory. The correct answer is option C, follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Laboratories commonly reject unlabeled specimens. Patients cannot resolve specimen identity errors reliably. Guessing can cause a serious misidentification error. Question 33. For a patient encounter in a cardiology practice, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, use the first visibly dirty drop for every test. Option B, skip patient identification because the test is quick. Option C, puncture through visible dirt. Option D, clean and dry the puncture site according to protocol. The correct answer is option D, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Patient identification is required even for quick point-of-care tests. Contamination can affect the sample and infection risk. Question 34. While working in a patient intake station, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A, gently adjust the needle position while maintaining safety. Option B, remove the tourniquet and continue filling all tubes. Option C, label the empty tube as collected. Option D, probe aggressively until blood returns. The correct answer is option A, gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. A tube without the required specimen must not be labeled as completed. Excessive probing can injure tissue and increase patient discomfort. Question 35. The care team in an outpatient laboratory asks for guidance because a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 5 milliliters. Option B, 10 milliliters. Option C, 1 milliliter. Option D, 0.5 milliliter. The correct answer is option D, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. Question 36. After reviewing the situation in an internal medicine office, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, protein in the stool. Option B, air in the lungs. Option C, sugar in the blood. Option D, the blood in the urine. The correct answer is option D, blood in the urine. Hematuria means blood is present in the urine. Protein in stool is not hematuria. Air in the lungs is not described by hematuria. Sugar in the blood is described by glycemia terms. Question 37. At the start of care in a walk-in clinic, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, Sims. Option C, Fowler. Option D, a prone. The correct answer is option A, supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Prone means lying face down. Question 38. Given the workflow in a community health clinic, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, record the first seated blood pressure as orthostatic. Option B, measure only oxygen saturation while the patient is seated. Option C, have the patient walk quickly before the measurement. Option D, measure blood pressure and pulse in different positions according to protocol. The correct answer is option D, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Exertion can distort the readings and increase fall risk. Question 39. After reviewing the situation in a certification exam scenario, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, code every visit as preventive care. Option B, verify insurance eligibility at each visit according to policy. Option C, skip registration for returning patients forever. Option D, use the oldest card in the file without asking. The correct answer is option B, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Coding must reflect the service and documentation. Returning patients can have changed insurance or contact information. Old cards may no longer reflect active coverage. Question 40. While working in an electronic health record review, a centrifuge is used in the laboratory. Which safety practice is important? Option A, stop the rotor with a hand. Option B, balance tubes before starting the centrifuge. Option C, open the lid while it is spinning. Option D, place only one tube at any weight in the rotor. The correct answer is option B, balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Stopping a rotor manually is dangerous. Opening a spinning centrifuge is unsafe. Unbalanced loads can damage the machine or specimens. Question 41. To protect safety in an outpatient laboratory, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A, movement can create artifact that makes the tracing harder to interpret. Option B, movement changes the patient's blood type. Option C, electrodes are used only to deliver medication. Option D, the machine cannot record any heartbeat unless the patient holds breath for 5 minutes. The correct answer is option A, Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Movement has no effect on blood type. Electrodes detect electrical activity and do not deliver medication during a standard recording. Normal breathing is usually allowed, but excessive movement should be avoided. Question 42. Before the visit continues in a same-day appointment, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, file the result for review at the end of the month. Option B, discard the result because it is abnormal. Option C, tell the patient the exact diagnosis without provider review. Option D, notify the provider or designated clinical staff promptly. The correct answer is option D, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Delaying a critical result can put the patient at risk. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Question 43. During a treatment room, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, directly into a vein. Option B, deep into the deltoid muscle only. Option C, abdomen with adequate subcutaneous tissue. Option D, into an area that is bruised and inflamed. The correct answer is option C, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Intravenous administration is a different route and is outside a subcutaneous injection. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Bruised or inflamed tissue should generally be avoided. Question 44. A medical assistant is working in a preventive care visit when the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, open hours. Option B, double booking. Option C, clustering. Option D, wave scheduling. The correct answer is option B, double booking. Double booking places more than one patient in the same appointment slot. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Wave scheduling schedules several patients to arrive at the beginning of a block. Question 45. A medical assistant is working in an urgent care office when a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, dilute the solution more to reduce odor. Option B, use the disinfectant only on clean hands. Option C, keep the surface wet for the full listed contact time. Option D, wipe the surface dry immediately. The correct answer is option C, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Unapproved dilution can reduce disinfectant strength. Environmental disinfectants are not hand hygiene products. Removing the disinfectant too soon can make it ineffective. Question 46. The care team in a cardiology practice asks for guidance because a patient questions a medication that looks different from the usual dose. Which response is safest? Option A, tell the patient that questions are not allowed. Option B, give the medication quickly before the patient refuses. Option C, document that the patient was difficult and continue. Option D, pause administration and verify the order and medication. The correct answer is option D, pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Patients should be encouraged to participate in safety. Rushing increases risk and ignores a safety concern. Labeling the patient does not resolve the possible medication issue. Question 47. Before the visit continues in a diagnostic testing area, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, place electrodes over clothing. Option B, prepare the skin according to protocol to improve electrode contact. Option C, ignore loose electrodes if the tracing prints. Option D, wet the electrodes with tap water only. The correct answer is option B, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Loose electrodes can create artifact and poor quality results. Unapproved moisture does not replace proper skin preparation. Question 48. In a patient education session, the provider mentions the largest artery in the body. Which vessel is being described? Option A, vena cava. Option B, pulmonary vein. Option C, carotid vein. Option D, aorta. The correct answer is option D, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 49. To protect safety in a phlebotomy station, a subpoena for medical records arrives at the office. Which response is best? Option A. Ask the receptionist to summarize the chart from memory. Option B. Give it to the provider or designated privacy officer for proper handling. Option C. Ignore it because subpoenas never apply to clinics. Option D. Immediately fax the entire chart without review. The correct answer is option B. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Summaries from memory are unreliable and not an appropriate legal response. Subpoenas can require action and should not be ignored. Records should not be released without verifying legal requirements and scope. Question 50. A medical assistant is working in an outpatient laboratory when a provider orders spirometry in the office. Which patient action is required? Option A. Hold both nostrils and refuse to exhale. Option B. Follow instructions for a strong, complete breathing maneuver. Option C. Remove the mouthpiece before starting. Option D. Talk continuously during the maneuver. The correct answer is option B. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. Question 51. Before the visit continues in a telephone triage workflow, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Use expired kits if the package is unopened. Option B. Skip controls because waived means unregulated. Option C. Report results before the test develops. Option D. Follow manufacturer instructions and quality control policy. The correct answer is option D. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Question 52. Before the visit continues in a community health clinic, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Follow office policy and patient communication preferences. Option B. Post the reminder on social media. Option C. Text any diagnosis to any phone number in the chart. Option D. Ignore all reminder preferences. The correct answer is option A. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Public posting would expose private information. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Question 53. To protect safety in a patient intake station, a tickler file is used in the office. Which purpose does it serve? Option A. Measure oxygen saturation. Option B. Draw blood into tubes. Option C. Sterilize instruments. Option D. Track future follow-ups or reminders. The correct answer is option D. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Sterilization requires approved equipment and process. Question 54. To protect safety in a diagnostic testing area, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Provide standardized guidance for office tasks. Option B. Eliminate the need for training. Option C. Replace all state laws. Option D. Guarantee every claim is paid. The correct answer is option A. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies support but do not replace staff training. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Question 55. To protect safety in a family practice clinic, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, PRN. Option B, NPO. Option C, SOAP. Option D, ERACE. The correct answer is option D, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. PRN means is needed and does not guide emergency fire response. NPO means nothing by mouth and is unrelated to fire safety. SOAP is a documentation format and does not guide fire response. Question 56. At the start of care in an electronic health record review, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Ask another patient what the abbreviation means. Option B. Interpret the abbreviation however it seems most likely. Option C. Clarify the order before proceeding. Option D. Ignore the medication order completely without communication. The correct answer is option C. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Patients are not appropriate sources for interpreting orders. Guessing can lead to serious medication errors. The order should be clarified rather than silently ignored. Question 57. During a clinical skills review, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Use only sterile gloves without a mask. Option B. Apply droplet precautions and offer a mask according to protocol. Option C. Place the patient beside an immunocompromised patient. Option D. Skip precautions if the patient is already taking medication. The correct answer is option B. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Treatment does not remove the need for appropriate precautions. Question 58. At the start of care in an infection control audit, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Open the tube and stir with a swab. Option B. Gently invert the tube the required number of times. Option C. Leave the tube unmixed until pickup. Option D. Shake the tube forcefully. The correct answer is option B. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Question 59. Before the visit continues in a preventive care visit, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Between. Option B. Around. Option C. Below normal. Option D. Above normal or excessive. The correct answer is option D. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Between is indicated by inter. Around is indicated by peri. Below normal is indicated by hypo. Question 60. The care team in a clinical skills review asks for guidance because the term otitis media is listed in the assessment. Which body area is involved? Option A. Stomach. Option B. Kidney. Option C. Middle ear. Option D. Liver. The correct answer is option C. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Stomach inflammation is gastritis. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Question 61. An office review in a medication administration visit shows that a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Administer the medication because it was ordered. Option B. Change the medication to another drug independently. Option C. Ask the patient to sign a form and give it anyway. Option D. Hold the medication and notify the provider. The correct answer is option D. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. Question 62. Before the visit continues in a clinical skills review, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Place the tube in direct sunlight to warm it. Option B. Shake the specimen vigorously for 1 minute. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Leave the specimen uncovered at the front desk. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Question 63. At the start of care in a telephone triage workflow, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Place the paper speed at 0. Option B. Help the patient relax and support the limbs. Option C. Remove all electrodes during the recording. Option D. Ask the patient to tense all muscles. The correct answer is option B. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Paper movement is needed to record the waveform. Electrodes are required to capture the tracing. Tensing muscles increases electrical artifact. Question 64. A medical assistant is working in a quality control review when the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A. Pulmonary artery. Option B. Aorta. Option C. Superior vena cava. Option D. Pulmonary vein. The correct answer is option A. Pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The aorta carries oxygenated blood from the left ventricle to the body. The superior vena cava returns venous blood to the right atrium. Pulmonary veins return oxygenated blood from the lungs to the left atrium. Question 65. Before the visit continues in a clinical skills review, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A. 4. Option B. Subcut. Option C. PA. Option D. IM. The correct answer is option C. PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. IM means intramuscular and refers to injection into muscle. Question 66. Before the visit continues in a family practice clinic, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Move the patient to a chair before assessing. Option B. Offer water by mouth immediately. Option C. Finish documenting the previous visit. Option D. Activate emergency response and assess breathing according to training. The correct answer is option D. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Question 67. An office review in a certification exam scenario shows that a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Lavender EDTA tube for serum. Option B. Light blue citrate tube for serum. Option C. A red or gold serum tube. Option D. Gray fluoride tube for all serum tests. The correct answer is option C. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Gray tubes are not the standard serum tube for routine chemistry panels. Question 68. The care team in a community health clinic asks for guidance because a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Copayment. Option B, premium. Option C, adjustment. Option D, deductible. The correct answer is option A, copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 69. In a medical office workflow, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, discard the first void and collect all urine for the next 24 hours. Option B, keep only the first void and discard the rest. Option C, leave the container unrefrigerated unless it smells unusual. Option D, collect urine only when symptoms occur. The correct answer is option A, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Timed urine testing requires all urine during the collection period. Question 70. To protect safety in a patient education session, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, spirometer. Option B, ophthalmoscope. Option C, otoscope. Option D, speculum for pelvic exam. The correct answer is option C, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. A vaginal speculum is not used to inspect the ear canal. Question 71. A medical assistant is working in a quality control review when a claim requires the code for an office visit procedure or service. Which code set is used? Option A, ICD-10-CM. Option B, CPT. Option C, policy number. Option D, zip code. The correct answer is option B, CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. Question 72. At the start of care in a women's health clinic, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, first drops of urine into an unclean container. Option B, specimen collected from the toilet bowl. Option C, clean catch midstream specimen. Option D, a random sample from an old urinal. The correct answer is option C, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Old specimens may be contaminated and may not reflect current results. Question 73. For a patient encounter in a telephone triage workflow, a patient feels faint during a blood draw. Which response should occur first? Option A, tell the patient to stand up quickly. Option B, finish filling the tube before responding. Option C, leave the patient alone to find paperwork. Option D, stop the procedure and protect the patient from injury. The correct answer is option D, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Standing can worsen faintness and lead to a fall. Continuing the draw can worsen the situation and increase injury risk. A faint patient should not be left unattended. Question 74. Following office protocol in an administrative check-in area, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, ask other patients to help verify the record. Option B, place all charts open on the counter. Option C, speak quietly and avoid announcing sensitive details. Option D, state the full diagnosis loudly to confirm the visit. The correct answer is option C, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Other patients should not be involved in private verification. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Question 75. In a same-day appointment, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, keep the screen facing the waiting room. Option B, disable audit trails to speed workflow. Option C, share passwords with trusted co-workers. Option D, lock the workstation before stepping away. The correct answer is option D, lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Audit trails support security monitoring and should not be disabled by staff. Shared passwords weaken accountability and violate security practices. Question 76. When a patient encounter unfolds in a pediatric clinic, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, otic. Option B, ophthalmic. Option C, sublingual. Option D, topical. The correct answer is option C, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Otic medications are placed in the ear. Ophthalmic medications are used in the eye. Topical medications are applied to the skin or surface tissues. Question 77. To protect safety in an infection control audit, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A, chain of custody. Option B, sterile technique. Option C, prior authorization. Option D, patient confidentiality. The correct answer is option D, patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Chain of custody concerns specimen handling documentation, not public conversations. Sterile technique concerns preventing contamination during procedures. Prior authorization concerns payer approval for services. Question 78. In a clinical skills review, the provider discusses the function of white blood cells. Which role is most accurate? Option A, store bile for digestion. Option B, help defend against infection. Option C, produce insulin in the pancreas. Option D, carry oxygen as their primary job. The correct answer is option B, help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Question 79. After reviewing the situation in a busy front office, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, battery. Option B, emancipation. Option C, coordination of benefits. Option D, defamation. The correct answer is option A, battery. Battery can involve intentional touching or treatment without consent. Emancipation relates to a minor's legal independence. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Question 80. Following office protocol in an infection control audit, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, move it over the venipuncture site. Option B, tighten it further until the vein bulges. Option C, ignore the time because tourniquets do not affect tests. Option D, release it and allow the arm to recover before continuing. The correct answer is option D, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 81. While working in a telephone triage workflow, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, gray tube. Option B, lavender tube. Option C, green tube. Option D, light blue tube. The correct answer is option C, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Question 82. Given the workflow in an administrative check-in area, a patient wants information released to a spouse. Which documentation is usually needed? Option A, A valid authorization or permission according to office policy. Option B. A verbal request from the spouse only. Option C. No documentation because spouses always have full access. Option D. A note written by the assistant after the fact. The correct answer is option A. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Authorization should come from the patient or legal authority. Question 83. To protect safety in an administrative check-in area, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Leave limited information and a callback number. Option B. Leave another patient's results for comparison. Option C. Demand payment details with full medical history. Option D. Describe the diagnosis in detail on the message. The correct answer is option A. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Sharing another patient's information is a privacy breach. Excessive information violates privacy and may not be necessary. Detailed clinical information may be heard by unauthorized people. Question 84. While working in a clinical skills review, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Document each transfer and maintain specimen integrity. Option B. Skip signatures if the specimen looks normal. Option C. Allow the patient to take the specimen home first. Option D. Use an unlabeled container until the lab receives it. The correct answer is option A. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Question 85. After reviewing the situation in a women's health clinic, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Ureter. Option B. Sinoatrial node. Option C. Gallbladder. Option D. Alveolus. The correct answer is option B. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. A ureter carries urine from kidney to bladder. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. Question 86. While working in a telephone triage workflow, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A. Excessive thirst. Option B. Painful or difficult urination. Option C. Difficulty swallowing. Option D. Ear inflammation. The correct answer is option B. Painful or difficult urination. Dysuria refers to pain or difficulty with urination. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Ear inflammation is otitis. Question 87. While working in an internal medicine office, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A. A normal calibration mark only. Option B. Correct limb lead placement. Option C. Poor electrode contact or patient movement. Option D. A properly grounded machine with still patient. The correct answer is option C. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Correct placement should reduce rather than create artifact. Good grounding and stillness reduce electrical or motion artifact. Question 88. To protect safety in a busy front office, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The electrodes inject medication. Option B. The test records electrical activity and does not deliver a shock. Option C. The test shocks every patient to start the heart. Option D. The machine draws blood through the wires. The correct answer is option B. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Electrocardiogram leads do not collect blood. Question 89. At the start of care in a preventive care visit, a complete blood count is ordered. Which tube is most commonly used? Option A, light blue tube with sodium citrate. Option B, red tube with no anticoagulant. Option C, gray tube with fluoride oxalate. Option D, lavender tube with EDTA. The correct answer is option D, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Gray tubes are used for tests such as glucose or lactate depending on protocol. Question 90. Given the workflow in a quality control review, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, RICE. Option B, PERLA. Option C, PASS. Option D, HIPAA. The correct answer is option C, PASS. PASS stands for pull, aim, squeeze, and sweep. RICE refers to rest, ice, compression, and elevation for certain injuries. PERLA describes pupil assessment. HIPAA governs health information privacy and security. Question 91. When a patient encounter unfolds in a primary care office, a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, blood culture bottle. Option B, light blue tube. Option C, gray tube. Option D, lavender tube. The correct answer is option C, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Lavender EDTA is used mainly for hematology testing. Question 92. Given the workflow in a family practice clinic, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A, inflammation of the liver. Option B, high blood sugar. Option C, slow heart rate. Option D, fast breathing. The correct answer is option C, slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 93. Given the workflow in a telephone triage workflow, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, soap and water help remove spores more effectively from the hands. Option B, alcohol sanitizer is always illegal in clinics. Option C, gloves completely replace hand hygiene. Option D, hand washing is needed only before eating. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Hand hygiene is required at multiple points in patient care. Question 94. Given the workflow in a same-day appointment, a sterile package is torn before a minor procedure. Which action is required? Option A, spray the package with disinfectant. Option B, use the items if they look clean. Option C, tape the wrapper and use the contents. Option D, consider the contents contaminated and obtain a new sterile package. The correct answer is option D, consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Surface disinfectant cannot sterilize items inside a compromised package. Clean appearance does not prove sterility. Taping does not restore sterility after the barrier is compromised. Question 95. At the start of care in an outpatient laboratory, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A, allow the alcohol to dry completely. Option B, draw blood while alcohol is still wet. Option C, touch the vein again with an ungloved finger. Option D, blow on the site to speed drying. The correct answer is option A, allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Wet alcohol can sting and may affect specimen quality. Palpating after cleaning can contaminate the site unless proper technique is used. Blowing can contaminate the cleansed site. Question 96. Before the visit continues in a pediatric clinic, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Skip technique instructions because home cuffs are automatic. Option B. Use another person's readings if the cuff is shared. Option C. Write only the highest number ever measured. Option D. Record readings with date, time, and relevant notes as directed. The correct answer is option D. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Readings must belong to the patient. Selective recording can mislead clinical decisions. Question 97. Given the workflow in an exam room, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A. Ignore the symptoms because they are subjective. Option B. Give a diagnosis to save time. Option C. Tell the patient to search the internet for a diagnosis. Option D. Document the symptoms and tell the patient the provider will evaluate them. The correct answer is option D. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Reported symptoms are relevant and should be documented. Diagnosing is outside the medical assistant scope. Unguided self-diagnosis can be inaccurate and unsafe. Question 98. The care team in a patient education session asks for guidance because a rapid strep test requires a throat swab. Which technique is best? Option A. Collect sputum from a deep cough. Option B. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option C. Swab the outside of the lips. Option D. Touch the tongue repeatedly to collect saliva. The correct answer is option B. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Sputum is not the specimen used for a rapid strep throat swab. The lips do not provide the specimen needed for strep testing. Saliva and tongue contact can dilute or contaminate the specimen. Question 99. To protect safety in a diagnostic testing area, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. As needed. Option B. Every morning. Option C. Immediately. Option D. By mouth. The correct answer is option A. As needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. Immediately is STAT in common medical usage. By mouth is PA. Question 100. Before the visit continues in a patient education session, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Give oral medication before checking responsiveness. Option B. Wait for the provider before starting any response. Option C. Use the defibrillator on a conscious patient asking questions. Option D. Begin CPR and use the automated external defibrillator as directed. The correct answer is option D. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Oral medication is unsafe when cardiac arrest is suspected. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient.